Hello and welcome back to the Dubai Science Park Show. I'm Dr. Sheen, your host, and today we're here, day 3 of the World Health Exhibition, and we are going to have an incredible chat about women in healthcare leadership, but also a little bit about emergency, critical care, and a little bit about maybe mountain climbing. Please join me in welcoming my guest today, Dr. Ayesha Almemari. How are you?
I'm good. Thank you for inviting me and for the opportunity to share some of my thoughts, ideas, and ambition.
Of course. So tell me, how did you find today or the rest of the days for the summit?
Very amazing as always. And that transformation, moving to Expo, brought all that Expo 2020 memories.
Yeah.
So very, very warm welcome. As well, the exhibition had transformed, I would say, from where we were in Arab Health, which was amazing, to what I see today happening around here. So very amazed and impressed, to be honest.
Amazing. So tell us a little bit about what you do. I know you wear so many hats. You just told me that you are also a lawyer in training. Tell us, what are the hats that you wear?
So I'm an emergency physician full-time. I'm a critical care physician. So I would say both full-time as a clinician. And in addition, I did Bachelor of Law and currently lawyer in training, finished 1 year, now in the second year of my training. I do research in medical liability, burnout, and I have books published and research published as well. And on the side, so in my private time, I'm a mountaineer, a long distance runner, and started to learn swimming and cycling. So maybe one day I'll do triathlon, but currently focusing in completing the 7 Summit Challenge.
Wow, and 5 done, right? Out of the
5
7?
completed, 2 more to go.
Wow, incredible. I don't know where you find the time, but this is incredible. So, when we're talking about healthcare transformation, obviously here today, all we're hearing is about innovation, transformation, but you are a clinician, but you're also in the leadership side of things. So here, what do you think is Dubai, let's say, doing well when it comes to making sure that we are ready for the future when it comes to healthcare?
So connecting all minds together in this platform is one step. And I must say, I started working as a consultant. So I graduated 2002, but became a consultant in emergency medicine, critical care 2012. That transformation in healthcare in UAE in the past 15 years is amazing. Seriously, we are ambitious in UAE. We want to do more from what we are. We are able to do more. So we want to do that. If people plan to do it in 1 year, we want to do it in 1 day. So this is the ambition you sense around UAE.
Yeah.
And I guess in a way it's stressful, but we have the resources, we have the capability, we have the mind. So why not? Let's do it, right? So there has been a big leap of transformation in healthcare. So I would say if we talk about implementing AI, so AI is coming very, very, very fast. So one of the research I did last year and published was about medical liability when we use AI, diagnostic therapeutic application.
Right.
So even like kind of studying law, which law usually moves quite slow, and as a tradition, law will be edited or renewed every 10 to 15 years. Now, UAE had broke that rule and our legislation has been updated because science is updated. The world is moving fast. So we need to keep up with that if we want to develop and continue developing. So in all honesty, healthcare is moving in the right direction. Am I satisfied with what we achieved? I would say I am not, and I'm sure everyone is not, because we are capable of achieving more, and I'm certain we can achieve more.
Oh, wow. Amazing. So, I actually teach ethics and law of AI here. And you nailed this because in the UAE, we're so thinking ahead. Like we're already teaching young students about how to be ready for AI with the ethics and laws around it. But now taking it a little bit further, what do you think is something that needs attention when we're thinking about healthcare transformation as a clinician? What do you think needs attention right now?
So I would say we always put in patient first, and that's what we should do. But we need to pay attention to our manpower. So healthcare worker, including administrator.
Yes.
I would say when I researched burnout, I found data about physician, a lot of it, data on nurses. There is no data in healthcare leader burnout.
Oh, wow.
But I must say, in all the roles I play, my role as a clinician, there is burnout there, but it's the most joyful role I play. Like when I go to my shift, night shift must be stressful, But I'm at home there. I feel at peace there. Exactly. But when I am at the office as a leader, that's not an 8-hour job. That's 24/7 hour job. You keep thinking about decision you want to make, plan, strategy, and different things, right? So healthcare leader burnout is a reality, not well studied in research. We want to pay attention to our manpower healthcare force if we want to serve our patient right.
Right. But now that you've touched on this, in a leadership role, what do you think are some of the skills or some of the, let's say, leadership qualities that help you thrive in that role? You already mentioned that it's a job that you do not switch off from. It's 24 hours, lots of pressure, but what helps?
So I would say authenticity is the first value I sort of like admire and try to be as authentic as possible as a leader. So listening to people around you, listening to different opinion and take them in consideration. As well, you want to be in the front line. You cannot be sitting in the office and not be connected. So usually I advise colleagues, if you take a leadership position, do not leave clinical practice. If you leave clinical practice in 5 years, you'll disconnect from what's going on in the front line. And your leadership decision might not be really aligning with what's happening. But if you keep these few shifts that you do, these few clinics that you do, if you're a surgeon, keep at least an OR once a week or once a month, then you'll be really on top of the problems happening in the front line and being able to make decisions that would solve the problem rather than decisions sometimes that are not implementable. Like you'll make a decision, but we cannot implement them. You see what I mean? So that's about all leadership levels. So we're not talking only about top leader, but I'm talking about all levels. I mean, you have a team with you. So if your team is not on the sort of ground with the people who are serving patients, then there's a bit disconnect between standard policies and then how we apply them.
Right.
And how to translate them to practice as well.
No, you're right, because then you don't know what you're solving. You don't even know what problem you're trying to solve. But now you are also a woman in leadership, which is incredible. We love to see how Dubai is really fostering an environment where we can see more and more women rising in terms of leadership. But what do you think can be done, whether it is in hospitals or anywhere around in the healthcare industry? What more can be done to move the needle to encourage more women?
So now I have a bit of maybe a little bit different opinion on that.
Go for it.
So now in UAE, women are empowered. No one can deny that.
Agreed.
I remember that growing up as a kid.
Yeah.
We were 6 daughters, 4 boys.
Wow,
we felt more empowered than my brothers, believe it or not. We got everything we wanted from my parents. Just, you want to study, go for it. You want to do this, go for it. They never held us back. We grew up hearing this from our former president, Sheikh Zayed, the founder of UAE. I mean, men are all partner in developing UAE. So we believe in that. Government, leaders, and as well population. So that's given. Now, in healthcare, I would say 70% of medical students are women. More than 90% of nurses are women. So we are there. Now, taking a leadership position, there is a lot of opportunity. Women are empowered. But when I come to choose someone for the role, I would say I'm going to go with talent. So here I'm going to challenge women and men. You want to take that position? Build yourself up to deserve it. So I want someone skilled who can do the role. He takes the role. I'm not going to put gender there. I understand all the sort of like kind of policies about giving opportunity for women. So I want them as well. Because sometimes our inherent bias of thinking, like when you say a leader, everyone think a man, does not think a woman, you see? So I believe in that. So I know about all these hidden biases. So we want these policies or about all that quorum, like 50% men or 50% women, all that. These are in place, so we want to implement them. But when it comes at individual level, if I choose someone, I'm going to choose the skill. Like if I have a woman who is more skilled than man, she's getting that seat. A man more skilled, he's getting that seat. Now, as anecdote, once I was part of a women health conference. And then the chair of the conference asked me, can you invite a speaker to give a talk about certain topic? So I'm like, yeah, I know someone who's expert in that subject. She said, okay, please invite her. I said, okay, sure. So I went. One of my colleagues, so I was talking to him, and I'm like, okay, we have a conference in this country about this topic. Can you please present with us? And he got excited. So what do you need from me? I said, well, okay, here are the conditions. You have to be a woman, And then I broke laughing and he broke laughing. What do you mean? I'm like, I'm sorry. I completely forgot about that we want women speakers to encourage women to be in the front line and in leadership and to present as well. And completely forgot and went for the skill because I want someone expert in that topic and he is the expert. Then I had to apologize. I'm like, okay, sorry, next time, but this time we really want women.
That is a very good point. Like, you clearly don't see the gender. The gender for you is just a part of the list of things that they need to tick if they need to. But if you were to speak to, let's say, anyone who's still younger than you, who is very, very new on their journey, what do you think can help them to make themselves better? As you said, to make themselves better so they can compete on the talent level.
So I would say jump to any opportunity. Every single experience add to you, and do not demand a lot of things. So, for example, I do a lot of volunteer work. It adds to me, makes me happy, and I learn. Many people, when I invite them to participate, they're gonna ask, "But what do you pay me back for my time?" I'm like, "We're volunteering, and you get a lot. Like, it's not all about money and paying you back. At one point, you might be paid back for such work, but then many times the learning is quite enough as a payback, and the opportunity to connect with other like-minded people and different background as well. So honestly, they should jump at every opportunity." Either a job role or a volunteer work or like teaching in a conference, attending a conference, connect with other people with the same sort of mindset or in the same field. That would add to their experience, would add to their skill, and would enable them when they are when they are offered a leadership position, they'll be equipped for it.
And I feel like, again, because this is almost mentoring and there's a lot of collaboration that becomes important. And this is why summits like this are so important, because we bring so many people from different spheres of the industry together where they can collaborate. But in your experience, how important is it for us to be future ready, to collaborate and get out of our different silos that we're sitting in?
So absolutely important. One, it does challenge you and makes you think, oops, what do I need to learn to feel more comfortable in this environment? And it does inspire you and does give you new idea. So, for example, today we have a session this afternoon about medical liability. Yes, I'm giving a talk, but usually I look at it, I'm going to learn from the audience by asking questions, hearing their ideas, and then exchange knowledge with them rather than only teaching them. So it's not only me being the teacher, but me being the learner there, sharing what I know. And I'm sure they're going to ask me a question. I'm not going to know the answer, but that would be a motivation for me to go and search about the answer for this question.
And how do you see the healthcare industry evolving in the next few years in Dubai?
I cannot imagine. I think, again, we're going faster than any imagination. So I really can't imagine. I mean, I would say what I think can happen in 5 years might happen in a year. So we'll need really kind of to think a little bit further than 5 years to be able to kind of guess what's going to happen in 5 years. But right now, if you look at our healthcare system, we have all the main building block in place. We're now sort of like kind of working at the fine tuning, more or less. So, I mean, people are working left and right. There's the private sector, the public sector, and then the regulator, and everyone is doing their role. There's absolutely a lot we can do, and I'm sure people is willing to contribute. But I cannot imagine what will be in 5 years, honestly. I mean, AI certainly will be there. This we cannot deny. I mean, I have published a chapter about AI in emergency medicine and critical care. I started looking at AI literature in emergency medicine, so application, how it can help us in emergency department in 2019, so before COVID. When I wrote the chapter in 2025, it was a lot of literature came out, a lot of application that 2019 were only thoughts, now are ready to be in the market. So application to help you with operation in the ED. So expecting patient volume, how you can run your volume, and how to make the care sort of faster and safer. And then diagnostic application and a robotic application that would assist you with the nursing manpower. Everyone around the world has shortage of nursing manpower. So if I have that robot going around giving you your medication that I prescribe, and the nurse can do something else that the robot cannot do, that will be absolutely an asset for the nurse and would make the patient care faster as well. And perhaps safer. I guess medication error will be a bit less with a robot than a human.
Of course. No, that's very encouraging. And you're so right. We don't know how quickly this will go. But I guess my final question for you is, as someone who wears so many hats, you seem to have a very good grasp of your work-life balance. You have time to summit mountains around the world. And I guess you've worked on burnout. You've published papers on this. So what advice do you have for anyone who's watching how to have a better balance of everything?
So I would share one book that I read 2017. I perhaps gave a gift of that book over 70 copies right till today. Peak Performance by, forgot the author name, but Peak Performance, a gray cover kind of book. If they Google it and they read it, that book is transformative. One is evidence-based, based on sport literature. Second, the author himself went through burnout. And third, the language written and the way they present their kind of solutions is very easy to read. And I simply reading that book, I've been teaching about it, and I've been applying this principle. And some principle did work for me, some did not.
Yeah.
But that book helped me how I can manage my time better. And then it did teach me stress plus rest equal growth. So if I want to grow in anything I do, yes, there are times I'll be stressed, I'll be working hard, but I need to plan my rest. So since then, in the calendar, as I plan this meeting, I plan a rest day in my week, and that rest day is protected. If I have a rest time, it's very protected. So that's a learning from that book, but there's a lot of learning in that book. Now, another thing I learned through reading as well is Wheel of Life. Wheel of Life simply tells you every one of us has 8 dimensions in life: family, work, career, right? And then your spiritual life, your financial life, and then add to that. So every one of them deserve from you some attention and priority.
Right.
So career is only one dimension. But in healthcare, because we're perfectionists to serve our patient to the utmost sort of like kind of perfection, we forget about life. We focus in career, and that leads to burnout. So what we say is, when I am at the bedside with a patient, I'm going to give 100%. But when I leave the hospital, I need to prioritize and I need to accept I'm not going to be 100% in every dimension.
Yeah.
My family might need my attention this month, so I'm going to give them more time than other activity. My career, maybe I'm writing exams, so my career need my attention. So I'm going to apologize from friend and family a little bit. I'm going to focus on my exam. So accepting that life is dynamic and your commitment is dynamic as well, rather than trying to be 100% at every dimension. That's not achievable. So when people say work-life balance, I tell them I don't like that because I cannot balance everything. But I say work-life integration.
Love that.
So integration means I'm going to work. Let's say if I'm coming to this conference, if my niece is interested in healthcare, she want to join me, I'll sign her up, I'll bring her. If I go for a mountain, I've been bringing family friends to mountain with me. So that would be, I'm doing what I love, mountaineering. I'm connecting with family and a friend. So I'm not depriving myself from family and friend. When I sign up to races like kind of 5K, 10K, and marathon, I make as well my kind of nieces, nephews, and sister and siblings to sign up with me. So we go all there, we share that experience, we enjoy it. So this way I can do what I want to do, which is running, mountaineering, and all that. And then I can spend time with them as well. So work-life integration, peak performance would be the 2 to summarize what I said.
That's beautifully said. Thank you so much, Doctor, for all the work that you're doing and for your time today. And good luck with your next hike.
Thank you. Appreciate it. Thank you.